the topic of this meeting, syndromic aniridia and metabolomics. So, as I've mentioned, PAX6 is essential for the development of the eye, but also the pancreas and the central nervous system. Haploinsufficiency is the underlying cause resulting in developmental structural defects associated then with secondary disease potentially arising later in life. And there are evidence of neuronal and endocrine abnormalities with obesity, hyperglycemia, insulin resistance, diabetes, autism, ADHD, depression, anxiety, and sleep disorders. So when we looked at our cohort of PAX6 aniridia patients, we found that nearly 13% of our cohort had diabetes, and this was twice the UK prevalence of diabetes. 23% had obesity, 7% had learning difficulties, and 2% had autism. And that was from quite a small cohort. So this is a brilliant review by Dominique. I suggest you all read this. But, she really nicely outlines a lot of the systemic features. We heard really nicely by James Lauderdale yesterday the structural brain anomalies, but we see midline structures affected in the brain, hyperplasia of the olfactory bulb, the pineal gland, the anterior and posterior commissures, the optic chiasm. And these defects will lead to these functional deficits in the patient. So abnormal central auditory processing, the difficulty localizing sounds and understanding speech in noise, olfactory disturbance, anosmia, and the sleep disturbances that we're seeing in patients. This is a beautiful table published in that review of the other clinical entities that were found in the PAX6 patients. So Ehlers-Danlos syndrome, cleft palate, ankylosing spondylitis, microcephaly, platelet disorders, hepatorenal polycystic disease, mucoviscoidosis. Now, doesn't necessarily mean that these are caused by the PAX6, but they were occurring also in these patients. So the study that we undertook a few years ago to investigate these systemic effects of PAX6 haploinsufficiency was to undertake whole metabolomic profiling of aniridia patients. So this involves essentially taking the blood plasma of a patient and looking at over 1,000 metabolites in the blood, including proteins, carbohydrates, lipids, vitamins, caffeines, various biochemicals. So we took 25 aniridia patients and we took 25 age and gender match controls. We took their blood plasma and we sent it for the whole metabolomic profiling. We also asked each patient to fill out a food frequency questionnaire just to ensure that the results were not skewed by an individual's diet. And there was no statistical difference between the age and gender match controls and the aniridia patient's diet in this sample. We had to exclude patients with WAGA, those with diabetes that were on medications for that, and also patients who were on statins, because that could obviously also skew their lipid profile. So the cohort description, there were 7 children, 18 adults. The mean age was 31 years. 48% were male. The BMI of the group, interestingly, the aniridia group had a higher BMI than the controls. That was statistically significant, another indication of the weight issues. And there was a range of mutations within this cohort. And this is the PCA analysis looking at the aniridia and the controls. And actually, when you look at this, there's little segregation of the biochemicals between the aniridia and the control group. However, we did find some differences, but just to also highlight the other clinical features that we saw in the cohort, 44% of these 25 individuals had obesity compared to 16% of controls. The aniridia group also complained of gastric reflux, hypertension, central auditory processing disorder, depression, anxiety, learning difficulties, ADHD, autism, pineal gland hyperplasia, and sleep disturbances. So 94 biochemicals were found to be different between the aniridia and the healthy group, and these were the kind of main pathways that we found were disrupted. So lipid oxidation, oxidative stress, complex lipids, neuroactive metabolites, and the microbiome-related metabolites. So I'm just going to go into a few of these. So lipid metabolism disruption was one of the most prevalent differentiated pathways. And these were markers of fatty acid metabolism, which were disrupted in our aniridia patients. And we've seen that in some of the other talks that were given yesterday. Carnitine was found to be increased, as well as dicarboxylate fatty acids and monohydroxy fatty acids in our aniridia patients. And the role of the carnitine system is to transport fatty acids into our mitochondria for conversion into energy, and it uses a process called beta oxidation. And so there's suggestions that there is mitochondrial dysfunction in our cells of aniridia patients. Increased carnitines have been linked to diabetes and heart failure. Lipid oxidation, again, elevated markers were also found in aniridia patients that were found in other conditions. So a condition called hypoketotic carboxylic aciduria is something that patients with hepatic carnitine palmitoyl transferase deficiency patients suffer from, and also Zellweger syndrome, which is a severe infantile paroxysmal biogenesis disorder. God, I'm so glad I'm not an endocrinology doctor. But basically, there are some rare conditions, and they have increased markers in lipid oxidation, which are also seen in our aniridia patients. These patients suffer from aciduria, hypoketotic events linked to diabetes and ketone metabolism, but also in Zellweger syndrome, they develop cataracts, which we know that our aniridia patients also suffer from. And so we can suggest that there may be a link with some of these biomarkers that could be also contributing to some of the features that we see in aniridia. So a group called plasmalogens were also disrupted. Now, plasmalogens are a class of phospholipids with antioxidant properties, enriched in polyunsaturated fatty acids. We found that these were actually decreased in our aniridia patients, and that's associated with the increased lipid oxidation that we're seeing in these patients. Again, in Zellweger syndrome, they have reduced levels of plasmalogens, and another condition called rhizomelic chondrodysplasia punctata. And both that condition and Zellweger, as I said, have cataracts. But importantly, plasmalogens have been detected in patients with metabolic syndrome, diabetes, and hyperlipidemia. So we're seeing these profiles of these biochemicals that are changed in the various directions that are associated with diabetes and hyperlipidemic states. So ketone bodies is another group. Carnitines contribute to the formation of ketone bodies. We know that there are increased carnitines in our aniridia patients. We also found accumulation of ketone bodies in our patients, but interestingly, with no associated change in the glucose level. There were other markers of the kind of ketone pathway, ketoacidosis, methyl succinate, isovalerate, that were raised. And again, taken all together, we can say that increased carnitines, accumulation of ketone bodies, increased bile acids suggest that aniridia patients could be in an insulin-resistant or pre-diabetic stage, so a glucose intolerant stage, the stage before you develop diabetes. Remember, we had excluded all diabetic patients from this study. Oxidative stress was another area that we found was disrupted. We found high levels of oxidative stress in the blood of our aniridia patients. Interestingly, there were increased bad markers of oxidative stress, and the kind of antioxidants were reduced in our aniridia patients. One particular antioxidant is called taurine, and this is a precursor of hypertaurine. Both of these were reduced, and the implications of that is that taurine is involved in bile acid synthesis, and it also stimulates insulin release. And altered plasma taurine levels are associated with neurological conditions like depression, autism, and with metabolic diseases like hypertension and obesity. So actually, my suggestion here is maybe that we need to look at that pathway in a little bit more detail, and maybe we should consider taurine supplementation for patients, because that may be a therapeutic option for syndromic aniridia in terms of helping increase the antioxidant state and counteracting some of the negative side effects that you get in terms of high blood pressure and obesity. We also found there were certain neuroactive metabolites that were increased. So a particular metabolite called N-acetyl aspartate that was increased. Its precursor aspartate was reduced. And N-acetyl aspartate is one of the most prevalent neurotransmitters in humans. There is a condition called Canavan's disease, which is an infantile lethal neurodegenerative disease, and they exhibit elevated levels of this neurotransmitter. You can also see accumulation of NAA in a condition called Lee's syndrome, which is a mitochondrial disease that exhibits acidosis and encephalopathy. And interestingly, increased levels of this particular biochemical has been detected in the brain of female children with attention deficit hyperactivity disorder. So if we just move on with this particular subject, I just want to touch on aniridia, autism, and ADHD. And this is work that I carried out with my consultant colleague, Ngozi Olunye, who's a pediatric neurodisability consultant who works with me at Moorfields and at Great Ormond Street. Just to say that autism spectrum disorder has a prevalence of 1 to 2% in the pediatric population. It's an impairment of social interaction and communication with restrictive, repetitive patterns of behavior, interest and activities, and an unusual response to sensory stimuli. ADHD has a 5% prevalence in children, characterized by hyperactivity, impulsivity, inattention, and distractibility. So we undertook a review of patients, children between the age of 4 and 15, and we recruited patients with just PAX6 aniridia. We undertook 2 questionnaires. First of all, the Goodman Strength and Difficulties questionnaire, which is a screening questionnaire for behavioral difficulties, and then the social responsiveness scale, which is specifically for autism spectrum disorders. And what we found was we were able to recruit 12 children. There were slightly more males than females. The mean age was 10. There was a range of ethnicities. Majority were white British. The average visual acuity was between 0.86 and 1 logMAR, and a range of mutations. And what we found in the strengths and difficulty questionnaire was in the areas of peer relationship problems, pro-social behavior, and overall total difficulties, there was a significant increase in the aniridia pediatric group. What was interesting was in those same areas where it was statistically different, the parents actually, when they carried out the questionnaire, concurred that there were significant difficulties with their children in those areas. So then with the social responsive scale, which is more associated with autism, here actually on all of the domains linked to social awareness, social cognition, communication, social motivation, repetitive behaviors, communication and interaction, there was a statistically significant difference between individuals in the general population and those with aniridia. And so what this suggests is that actually our children with aniridia should be screened for behavioural difficulties, and then formal assessments should be put in place for them. And potentially if we link that with some of the biochemical defects we see, then there is more evidence that there are this occurrence within this population. So I think I've said that. Just to say that there are confounding factors here in that children with visual impairment do tend to suffer from autism and ADHD. And we can't say for certain that PAX6 is definitely causing this. It could be an element of the visual impairment. However, we are starting to see quite high levels in our children. So either way, we need to think about this in the management of our patients. So just to conclude, this was one of the first comprehensive metabolic analyses of our aniridia patients. Despite excluding our diabetic patients, we found that there were strong biomarkers of insulin resistance in our patients, increased oxidative stress with reduced taurine that could be potentially linked to depression, autism, hypertension, obesity, neurotransmitter disturbances, which could be linked to mood, behavior, sleep, and the questionnaires confirmed that there is certainly a higher risk of behavioral anomalies in our children with aniridia. So I would conclude aniridia is not an isolated condition. There are significant considerations that we need to think about for the general health of our patients. One of those things are early referral to endocrine so that they can potentially be monitored for insulin resistance, glucose intolerance, and whether they should be started on metformin from an early time point. Obesity measures, taurine supplementation, and certainly early behavioural assessments for our patients. So with that, I just want to thank my team. I'd like to thank Dulce, who's in the audience. She undertook a lot of the metabolomic analysis. Dr. Ngozi Alunye for her assessment of the autism and ADHD, and Viv, who helped to recruit a lot of these patients, and all the funders. Thank you very much.